Good morning. We're speaking to you today from the territory of the signatories of Treaty 6, and I'd like to acknowledge the Métis people who share a very deep connection with this land. I'm pleased to be joined today by David Shepherd, MLA for Edmonton Centre and our critic for health, and also by Mike Parker, a paramedic and president of the Health Sciences Association of Alberta. Over the past few days, we've seen more and more indications that our entire healthcare system is under extreme stress due to the mismanagement by the UCP. In Red Deer, we saw 14 ambulances backed up in the hospital parking lot waiting to get to the emergency room. Days later, Red Deer Hospital had to divert all of its general surgeries to other communities. In Whitecourt, the cancellation of obstetrics for expecting parents has been extended for yet another month. In Lethbridge, Canmore, and Banff, there are tens of thousands of Albertans who simply cannot find a family doctor. In Edmonton, we're seeing dangerously long wait times for children at the Stollery Children's Hospital. And in Calgary, we saw the awful situation of children and parents lining up outside to even get a seat at the Alberta Children's Hospital emergency waiting room. Now, as a parent, it's painful to see families put through this stress on top of caring for a sick child. These are all symptoms of a healthcare system that is itself very sick and in deep crisis. And one of the most visible symptoms and one of the most visible parts of this crisis is the impact it has on Alberta's ambulance system and the people who work in it. Alberta Health Services quietly publishes a quarterly emergency medical services dashboard. The most recent dashboard was released in April, and it includes data from January of this year through March of this year. Ambulance response times for life-threatening calls in urban areas have gotten progressively worse over the past year, and now we see many of them are badly missing AHS targets. The slowest 10% of calls have gone from taking 12 minutes or more to 17 minutes or more, and that's a response to what is characterized as life-threatening calls. For context, 12 minutes is the outside target that AHS sets for its slowest calls. And now, what we're seeing is that these calls are being responded to 42% or more slower. These are the worst urban response times since AHS first started reporting them. And an additional 5-minute delay to reach a life-threatening call can have tragic consequences. Response times have also missed targets for 2 years running in communities outside of our metropolitan areas with populations that are larger than 3,000 people. Now, part of this problem is because ambulances in our major cities are getting stuck in hospitals for longer than ever. And AHS dashboard also measures this. In Calgary, 10% of calls leave EMS crews waiting 2 hours and 45 minutes or longer to hand their patient over to the emergency room. The AHS target is an hour and a half. Once again, these are the longest waits that we have seen reported in Calgary since AHS first began publishing this data. And these waits mean that more ambulances are being pulled into the city from surrounding communities. Being stuck at an overwhelmed hospital, especially when their shift should have ended, puts intense pressure on the mental and physical health of EMS crews, not to mention the Albertans who need them to be on the road. Finally, the data also shows that province-wide, the time it takes for AHS to dispatch an ambulance following a 911 call has also worsened dramatically. AHS sets a target of getting 90% of calls dispatched within 1 minute and 30 seconds and has met that target since 2016. But by early this year, in 2022, that time to dispatch 90% of calls had almost doubled to more than 2 minutes and 45 seconds. All of these numbers are clear signs of an ambulance and a hospital and a healthcare system that is under incredible strain. And I hear from EMS and emergency room professionals every day, and they tell me that they are worked to exhaustion. They are burned out, and they are so frustrated with the incompetence and the indifference of this UCP government. Incredibly, while heroic EMS crews struggle with high rates of sickness and burnout, the UCP is actually also pushing to cut their wages. The fact is, the UCP must be held responsible for the damage they are causing. Their hostility to public health care and their catastrophic mishandling of COVID has put patients, families, and frontline workers at risk. The bottom line is that Albertans can't trust the UCP to take care of their health care and their health. Imagine enjoying a day with your family and suddenly a child has an unplanned serious accident, or an older relative collapses on the kitchen floor, and not having the confidence that an ambulance will reach you in time to save those lives. Albertans have a right to expect an ambulance will come quickly whenever they are in distress. And EMS professionals, they have a right to work in a system that supports them in their critical work. Now, there are steps that the current government can take right away to deal with these issues. And for that, I will hand the podium over to Mike to make his remarks.
Thanks, Ms. Notley. Thanks, Mr. Shepherd. The only reason I'm able to speak on behalf of these members is because I'm hearing directly from the street, from those who are on the front lines today. And they make it very clear the solutions that must be implemented immediately in this system. The first step is to ensure that our frontline workers that we currently have as our members stay. And to do that, get them off shift on time. Forced overtime after a 12-hour call after call is devastating to their physical and their mental health. And that's step one. Step two, we have hundreds of unfilled shifts every week in this province. And yet we use a just-in-time workforce with 40% of our paramedics in casual positions. Move these folks immediately into full-time positions, working for their shifts, and no longer a just-in-time that we hope we can rely on. The third step, in this opioid crisis, we must reactivate all safe injection sites that are in this province and wraparound services to ensure that our communities have the supports they need to help our people who are their most vulnerable. These are three quick and easy steps that must be activated immediately to protect our healthcare, to protect our paramedics, and to protect all Albertans in our time of need. Thank you.
Thank you so much, Mike, for those very practical solutions. An NDP government will strengthen public health care, including hospitals and ambulances, and put the safety of Alberta families first. We will restart the relationship between the government of Alberta and all of our frontline healthcare professionals. We will halt the UCP's reckless and chaotic rush toward privatization and reorganization for reorganization's sake. And we will stop the shell games with funding numbers and provide to our healthcare frontline workers and the system itself the real resources that we all need to ensure that all Albertans can get the care we need. Thank you, and we either of us are both happy to take any questions you may have.
Thank you, and we'll go to questions on
Any
the
of
phone.
us, actually, yeah.
Just a reminder to press *9 if you're joining us on the phone, raise hand function if you're joining us via Zoom. If you could say your name and your outlet at the top, we'll go to our first caller.
CBC. I have some questions for Mike Parker. Mike, I was interested in hearing a little bit more about what you said about 40% of the workforce is casual and what you call a just-in-time workforce. Can you explain, first of all, what you mean by a just-in-time workforce?
The EMS system currently in this province is structured where there are some full-time paramedics out there that have regular shift schedules that include a Friday night, Saturday night, these kinds of shifts. We also have 40% of the current employee structure of AHS EMS that operate as casual. So they can pick up 1 or 2 shifts a week or every month or whatever they want to satisfy their needs. We need to move these people into full-time positions to ensure that those seats are filled. Right now, as I said, 300 vacant seats on ambulances in this province. We don't have the paramedics. They're out there. We have the vehicles. We just need to match them up and ensure that they get full-time work. It seems very simple to me.
Any follow-up?
Yeah, and as a follow-up, Mike, I mean, do these people all want to be full-time? Because perhaps maybe people just wanted to pick up a couple of shifts. I mean, what are you hearing from these people?
Directly from the front lines, I am hearing day in and day out, they want full-time. Are there those that choose some casual? Yeah, there are. But when we choose to bring on shifts that are only for 89 days at a time to avoid any cost implications, it is just tragic because we have no commitment to the people that we have entrusted the safety of all Albertans with. Put them in full-time, at the very least, ask the bloody question, and let's find out.
Anything else, Michelle?
Yeah, so you say 89 days at a time, so they're basically being brought on for 3 months. Is that right? Like sort of, I wouldn't say, I don't know, it's probably not a 3-month contract, or is it a 3-month contract? How does it work?
In some cases, they offer them 89 days, so 1 day less than 3 months, so that they don't have to pay them benefits or a pension. So these folks are operating currently with no benefit plan. That's the reality of it. That's their cost savings. It's on the backs of those folks that are out there that we've entrusted to save us. And so, you want to fill the seats? We have the people. Offer them full time.
Go to our next caller.
Thanks, Mike.
Hi, Catherine Gurkowski with Alberta Today, also for Mike. Back in January, the health minister had announced this 10-point plan to address the EMS shortages, and then said that and struck this committee and said apparently this report is due this month. Have any of those 10 points done anything to address the situation or make things better?
I'll speak to 2 parts of the 10-point plan, and also the committee that you referred to is due with an interim report at the end of May, and I don't have a lot of faith in how that's going to roll out, but we'll have to wait and see on that one. 2 pieces on the 10-point plan that speak of getting rural units back into rural communities. We have done a horrible job of maintaining healthcare in the rural communities in this province by closing hospitals, deferring services to major centres who are already overloaded. So the only thing that the community had for a healthcare structure or system were the paramedics, and they were found caught in the city in the cycle of trying to respond to calls here. So one of the 10-point plan items is get those units back to communities. Great idea, I support it. Fallout from that, the consequences of that, are 40 stacked calls in Calgary on May 2nd and 3rd. So we have now stacked cities with no available resources, with 40 calls holding in their 911 system and no paramedics to respond. So that isn't working. Their other conversation on getting units out of the hospital, I need to be crystal clear. The hospital delay is not a paramedic issue. This is a systemic hospital healthcare issue. From entry to exit and everything in between, this healthcare system has been starved out for the last 20 years, and this is what it looks like. So this isn't a paramedic issue, this is a healthcare issue, and responsibility lies with the Minister of Health. Thank you.
Anything further, Catherine?
Yeah, when you say you don't have a lot of faith in the committee, have they been in contact and consultation with you? If so, how have those conversations gone?
I'll be clear, I sit on this committee as one of 30-some folks that are trying to have these conversations. And you can appreciate that there is a lot of dynamics within these conversations. As I've stated today, and I've stated every opportunity at committee, get our folks off on time, get those trucks filled with the paramedics that we have, and start working on a wraparound service and supports at safe consumption sites. These are the 3 pieces that I continue to advocate for. We need resources in this system. We haven't put extra paramedics on the road in this province in over 10 years, and yet we've had a 60% increase in call volume. So these are the conversations that I take directly from the mouths of paramedics that work here and insert into these committee. We'll see what comes out as a recommendation at the end of May.
Do one more pass for questions. *9 if you're on the phone. Raise hand function if you're joining us via Zoom. And seeing none, that's all for today. Thank you.
So I have a question for you. So the committee, so much for watching, and to learn more, check out albertasfuture.ca.